Hi, everyone, and welcome to Thrive 2020. I am Loretta Maddox, and I am a senior compliance consultant for Healthcare Compliance Pros. I am super excited to be participating in this conference. I have so many friends from many of the different organizations that are participating, and as much as I miss being with you guys in person, again, I am super excited to be presenting to all of you today. So before I begin, I want to let everyone know that this is a recorded session, but I am available to chat live if you have questions throughout the presentation. So don't feel like you have to wait until the end to ask a question. If something pops in your head and you want to send it over in chat, I'm there ready to answer those questions as they come in. Of course, we will have time at the end if you do want to just listen to the presentation and then save those questions for the end. That's totally fine as well. We just want to make this as interactive and as beneficial to the attendees as possible. So I actually have two sessions that I'm going to be speaking on today. So the first one, both have to do with remote workers, but this session is going to be about the HR side, just managing those remote workers. We're going to talk about some of the benefits that you may have from being able to utilize remote workers, but we're also going to talk about some of the challenges and how you can implement things in your practice to help with some of those challenges. Now, the second session, which is in the next breakout session, is going to have to do with the privacy and security aspects of a remote workforce. And not only just working remotely, but also taking into account providing telehealth and the enforcement discretion that is in place from a HIPAA standpoint and how those things differ and what you need to do going forward. So if you're interested in more information about the security and technology side, then that's definitely a session that I recommend that you attend. So I am going to go ahead and get started and share my screen with you so that you can see the presentation. So we'll just go ahead and get rolling. So HR management of remote workers. I first of all wanted to share with you some information that I found, which I thought was quite interesting. So Stanford did a survey, their Institute for Economic and Policy Research did a study that included 2,500 adult workers. And they did this study during May 21st through the 25th of this year. So during this current situation that we're in, actually, toward the beginning of when it really started. So in that study, they found that 42% of the individuals that were a part of that study are working from home, with 25% or 25.5% still going into their place of business, and then 32% not working at all. So of the individuals working, 2/3 of those individuals are working from home. So this is way different than what we're used to, and especially from a healthcare standpoint. Now, I know you guys don't have to see a survey to understand the impact that the COVID-19 public health emergency has had on the workforce, but I did want to just give you some numbers so that you can understand it's not just you, this is happening everywhere. And even though there is a large number now of individuals working from home, not every job can be done from home. Clearly, people that are in grocery stores need to be able to purchase items from somebody. So people have to go to work if they work at a grocery store. If they're in the transportation industry, that's clearly something that you can't do from home. Any type of repair work, construction, those types of jobs, they don't have the ability to work from home. Delivery services, clearly they need to be out and about to do their jobs. And what about personal care services or restaurants? I mean, I don't know about many of you, but I know I have really missed the personal care services being able to be provided. So I'm happy that some of those things are coming back in a lot of the areas where we work and live. But the point is, not everyone can work from home. And even in healthcare, there are going to be some of the positions in your practice that may not make sense in a remote work environment. So let's look at what could make sense for remote workers in healthcare. So information technology. The revenue cycle management, those are things that can be done not necessarily within the practice, but they can be done remotely. Call centers, appointment scheduling, human resource management. I know that might seem a little like something that may not be able to be done remotely, but with the technology that we have in place now, it can. And I will tell you that I work for a company that is 100% virtual. And so all of these things, I know there are some things in this list that is specific to healthcare, and our role is healthcare compliance, but yet, human resources, being able to make appointments, talking with clients, all of those things can be done remotely. And I think what you guys are finding in your practices is that there are many things that you didn't think could be done remotely, but because of the circumstance, you've had to figure those things out. Also, even some nursing activities or some healthcare being provided, those are things that can be provided remotely, as we've seen with an increase in the number of telehealth visits that are being provided, but not just from a telehealth standpoint, also from case management or triaging patients over the phone. Those are things that can also be done remotely. And then, of course, administration. Is another area of the healthcare workforce that can be done offsite. So, how did we get here? Well, I think COVID-19 definitely gave us a boost into the remote worker side of things, because I don't know that healthcare has embraced it as much as some other industries. But because of what has happened during this current public health emergency, we've had daycares and schools close. So parents that would normally need to be coming into the office, they now have no care for their children. So we had to accommodate that. We've also had to deal with individuals who have sick family members, and so they need to care for those sick family members. Or if they have those sick family members, they've been exposed, and so they can't really be back out in the workplace yet until we know if they are clear or if they're going to continue to potentially infect their coworkers. So we have to make sure that we're allowing that time to be away from the practice. Your high risk employees, this is healthcare, so you're probably having patients, depending on your specialty, well, any specialty, you could have patients coming in who have COVID-19. And so if that is something that could put your employees that are at higher risk, that's another reason why you might need to look at a remote worker situation. And then obviously just contracting the virus. If you have an employee that has COVID-19, they clearly have to be at home. The thing is, though, that there are all of these reasons that have pushed us to this remote work environment, but why hasn't this worked before? And so here are some things that I've talked with others in the industry about to just give me some of their insight on why has remote work in healthcare not really worked? Well, number one, there is the fear that if we let people work from home, how do we know that they're actually going to be working? And we're going to talk about some solutions to that in just a few slides. But next, how are you going to keep track of employee time? How are we going to manage those employees if we can't see them? And then how are we going to interact as a team? This is something that is a big concern for many in work environments where, you can get up and walk to someone else's office and ask a question. And will those things happen in a remote environment? And again, we're going to talk about some solutions to help with that. And what if there is a compromise of patient or company information? This is a big one, especially since many of you are covered entities under the HIPAA rules. And so you do have an obligation to protect protected health information, whether it's on site in your practice or if it's being accessed or used or disclosed remotely. So this is a big concern, and some of those concerns we'll talk about in my second session. But then what about where employees are going to be doing their work? Do they have a place that is going to be quiet, that is going to keep them from distractions, or are they going to be working at their kitchen table? And so these are things you have to consider when you deploy your workers to work in a remote environment. And then finally, will they be distracted? And again, I think this is a big one as well. So let's talk about being distracted at work. So distracted at home as a remote worker or distracted in the office. I think all of us can admit in some capacity that just because you're working at home doesn't mean you're going to have more distractions. We're distracted at work as well. So I don't want this to completely turn those of you off who are maybe thinking, we just can't do this because I can't guarantee that my employees are going to be able to stay focused, because we have a problem staying focused in the office as well. So we've just changed things a little bit where we are distracted at work, maybe by our coworkers, to now remote workers and being distracted by the things that are happening at home. And just like I mentioned before, we are at a time right now that it's different than what it would have been prior to COVID-19. If you were looking at remote work environment prior to COVID-19, there might not have been as many distractions at home. But now, with schools closed, with other individuals that are also working from home, you could have an entire family that is basically at home all day, every day. And so, yes, there are probably going to be a little more distractions than there would have been in a non-COVID world, but those distractions are happening at work as well. We just have to manage them a little differently. So let's talk about some of the potential benefits to utilizing remote workers. So if you are going to look at the things in your practice that can be done remotely, you're not going to need as much office space. So I'm not saying that right now you should go, sell your building and buy a smaller space. But if this is something that continues and you continue to allow people to work remotely, the next time you renew your lease, you may not need as much space. So that is a potential benefit. Also, if you own your building or if you can't change your lease and you have all of this space, but now it's not being utilized by your billing office, for example, this is increased space that you could use to see more patients. And especially now that we are needing to make sure that we're social distancing everyone. So you can either add that empty space now that used to be an office, you can either make that an exam room or a procedure room, or the employees that have to be in the office because they can't do their job remotely, that gives you more space to provide social distancing. So that's some additional benefits to having those people who can work remote do work remote. There's a potential for increased productivity, and you're going to see this on the challenges slide as well. But people that have the ability to work from home, in some studies, have been shown to be happier, to be more productive because they feel like they can have less distractions. So there is a likelihood that by sending some of your people home to work, you could see more productivity out of them. Now, it's not going to be with every single employee because people are different, but this is something that you might see when you are sending some of your people to work remotely. This is a big one. So retention of employees who really need that work environment. If you are at a point now where you have determined that you have these positions that could be done from anywhere, what if you have a fantastic employee that all of a sudden needs to move to another state? Well, before the ability to work remote, you're going to lose that employee. Now, if you have things in place that allow you to have that remote work environment, you don't have to lose that really good employee. And I think this is huge because once you find really good employees, we want to do everything we can to keep them. So this is another benefit to having that remote work environment. And then finally, if individuals are having to take off, for example, because they have a sick family member or because they have a child who is having to do virtual school and they can't leave them alone and they have no one else to care for that child, are they just going to have to be off? Or can they work remotely and still be productive? Or if there is just that situation where they have to be off to care for someone who's sick, they're still able to work. They're just not physically in the office. So we want to, if you can, and it's reasonable, give them the ability to provide or to do their job at home because they have to be, instead of having to take sick time. And then you as the manager have to figure out, okay, how are we going to juggle all this? How are we going to make sure that we get everything done on our end? So some potential challenges. So with any offsite worker, there is the likelihood that there's less supervision. Now, there are some things you can do, and we're going to talk about those in just a bit, but you lose that level of being able to just pop into someone's office and see if they're playing solitaire on their computer or if they're actually working. You're going to lose that. But there are methods to have in place to keep that from happening. Also, there, as I mentioned on the last slide, from a challenging standpoint, there is a potential for decrease in productivity. But this is something that I think you need to look at on an individual level. I don't think you can make the assumption that all workers who have been in the office and now they're going to be at home. I don't think you can just make the assumption across the board that they're just going to be less productive, because as I mentioned earlier, sometimes you see a higher level of productivity. So, but do keep in mind that there is that potential. There's less time to collaborate in teams, less opportunity to collaborate in teams face to face. However, there are some opportunities to collaborate in other ways, but you do lose this aspect again when you move people away from the office. Now, this one's going to be tough because you are going to have people in your practice who just cannot do their job from home. And just like this few slides ago, where I was showing you the actual hands-on care that needs to be provided to patients, you're going to have a certain level of employees that have to be in the practice. That there may be that sense of unfairness for those who can work outside of the practice. So I think if this is something that you're doing in your practice or you're thinking about doing in your practice, you really have to look for ways that you can make it seem less unfair. And that may be by maybe offering some alternate schedules for those that do have to be in the practice, that maybe you give them the opportunity to shift their schedule a little bit so they do have some things that they can either do remotely or where they can have some time away from the practice. And those are things that can be done creatively. And I think if given the time to think through those scenarios, you can look for ways to keep your workforce happy. But just understand, if you haven't experienced it already, you probably will, because there's going to be somebody in the practice that feels like it's not fair that Sally gets to work from home, but she doesn't. So you just want to make sure to be prepared for that. And then some of the other challenges are technology, just in and of itself. The reason that we're recording this presentation is so we can cut down on the potential for any type of technological issue, because we have those. We have internet issues, we have equipment issues. And so when you do have those remote workers, there is that chance of having that happen. And maybe the individual who's working remotely, they may not understand how to fix that, when in the practice, you can call whoever is responsible for IT and they can come work on it. So you do have that as a challenge as well. And leadership and mentoring opportunities may be a little bit harder to realize. And this is because, again, we're not face to face and we're not running into people in the hall that we can ask a question, or we're not able to, when we get stuck with something, we can just immediately walk into the manager's office. So these are those challenges that we really have to look at. How can we address these challenges and still allow individuals to work from home? So let's talk about that. So over the next few slides, I want to spend some time with you talking about how to create a successful remote worker environment and how to manage that. And so it really starts with the first step is determining roles that can actually work remotely. And when I say roles that can work remotely, I mean, does the role, whether it's a nursing position, a compliance position, a billing position, whatever the role is, not the individual, but does that role in the entire capacity of those job duties require face-to-face interaction? If it does, can the face-to-face interaction be done remotely by video communication? And so I think the answers to those questions are going to help you determine which roles can work remotely and which roles can't. And what you also may find is that sometimes it may not be all or nothing. It may be that a component of that role can be done remotely, but not all of it. So that's where you may have some of your staff that are coming in 2 days a week to handle the things that they can't do remotely. But then the other 3 days of the week, they can work remotely and they can handle those things. So I think I want you to try to keep an open mind as you are assessing the roles that can be sent to a remote work environment. And then for those roles, will there be adequate access to the appropriate technology and systems to perform their duties? And so this is going to kind of go hand in hand with some technology issues that we're going to talk about in a second. But if a role involves very specialized equipment that can't be sent home with the employee, then clearly that's going to be one of those roles that can't necessarily work in a remote situation. So you have to take those things into consideration. So once you determine the roles that have the opportunity for remote work, then we have to look at which employees within those roles can do this. And not everyone is going to be suitable for remote work. And I'm sure some of you right now are going, yes, I know, because we've tried it and it has been unsuccessful. So you really do have to look at this. And think about employees who, if you have employees right now who already need extra supervision in the office, there may not be a good fit for a remote work position. Now, does that mean that if put in a situation where they absolutely have to work remote, that you might make those accommodations? Then yes, you may have to make those accommodations, but there's nothing that's going to require you to do that permanently. So I really want you to take time to consider who really can work from home. And another thing to think about is looking at their past performance while in the office. Are they a good worker? Are they dedicated? Are they productive in this environment? And that is going to help you determine if they can be productive in the remote environment. And this is all something that can be done by trial and error as well. So yes, you want to look at this on the front end before you start just sending everybody home, but you can always give it a try. And you can allow an individual to work from home for a short period of time and monitor their performance and figure out, okay, is this going to work for them or is it not? And if it doesn't, then you're in a situation where you bring them back. Again, there's nothing that says that you have to do this forever. So look at these things when you're trying to determine which employees can work remote. I think it is so important to have clearly outlined responsibilities and expectations. So when you are sending that employee and giving the employee the opportunity to work from home, they need to understand what their responsibilities are, which means they should know, based on if you already have a job description in place, they should know what their responsibilities are. But they need to understand that those responsibilities aren't going to change just because they're remote, unless you're going to allow them to make some changes. And these are things that you need to talk about on the front end. So are they going to work the same hours per week or per pay period? Are they going to be expected to work 40 hours a week? Or are they going to have different time requirements? And in addition to just the hours per week and per pay period, what about availability? What we have seen in some of the studies that I've read, and I even know this, I am a remote worker. So I will tell you, there are days where I might start my day at 6 a.m. and then be done at 3 p.m., but then I may come back at 7 o'clock and do a few things. So which positions in your organization that are working remote have that ability? If I'm a call center employee, I know, or I should know, and you should be telling me, when I need to be available, when I need to be answering the phone, when I need to be returning emails. But if I am submitting claims, can I do that at 8 o'clock at night after I've put my child to bed? Is that going to be acceptable? Because that's the environment that we're in right now. And so I think you have to consider these alternate schedules. Now, again, this is going to be based on roles and based on employees. So you've got to think through this, and I highly encourage you to put these expectations in writing, go over them with your employees, and make sure that there is a good understanding, because these are the things that you're going to be measuring productivity from. So they need to understand that if they want to be able to continue to work remotely and it's working for everyone, they need to meet these expectations. So another thing to think about is the workspace. As you can tell from my video, I'm working from home. So I made sure I was not going to do this video sitting on my couch or in my bed, sitting, just with my nightstand right next to me. These are things that you really need to talk about with your staff if they're going to be doing any type of video conferencing, because you want to make sure that they are professional. You also want to make sure that they can minimize distractions and have some private time during work times. And this is where it comes in, where you may have those alternate schedules for those who can, where they know, okay, after kids are done with school, and my spouse gets home, they can take care of the kids while I spend some private time with minimal distractions on my work. So you won't always have optimal privacy, I think, when working remote, but you want to encourage as much of that as possible. And as I mentioned about video calls, so professional attire or a professional area when your employee is going to be doing any type of video call. And I'm not saying they have to wear a suit. I mean, I'm not saying that that it can't appear that they're at home, but you do want a level of professionalism if they're going to be dealing with your patients or if they're going to be dealing with each other. We want to make sure that you have at least addressed this. Don't just make assumptions. So be sure to outline this with your staff. Reduction of background noise. So this one's a hard one because it's not always going to work. There have been times that I've been on webinars that there have been very loud dogs walking past where I live with a window open. So those things are going to happen. Your staff may have children that are maybe a little rambunctious and they could be loud. I think the point I'm trying to make is you can't reduce it all, but if you're going to allow people to work remotely, they're going to have to do their best when they know they're going to be on the phone with a patient or with someone that is work related. They need to limit as much of that background noise as possible. Will it all go away? Absolutely not. Are many of us adjusted to this because of the world we live in right now? Yes. If I hear a dog barking when I am on the phone with a client, I'm not going to be too upset about it. But again, we want to try to limit that as much as we can. And then I'm going to touch on this a little bit, but I really touch on this more in the next session. But make sure their office workspace has the ability to secure and appropriately destroy any paper documents that contain protected health information or any confidential information that your remote workers may have. And we'll talk about equipment in just a second, but it is so important that in that workspace, and when you are discussing this with your employees and putting this in writing, you want them to understand they cannot allow unauthorized individuals to access protected health information. And in the home work environment, unauthorized individuals can be a spouse, it can be a neighbor, it can be a child. So that's why the workspace definition is very important. You may have individuals and employees who they have no other place to work except their kitchen table. Well, that is a discussion you need to have. And are you going to be okay with that? And can you secure that from a HIPAA standpoint. Now, I'm not saying that you can't do it, but I'm saying you have to have a discussion about it, because it needs to be very clear to the employee that you have expectations that they will protect the information that they come into contact with, that they have out, and that they are accessing, just like if they were in the office. So this is a very important thing to remember. So equipment and connectivity. So you need to determine what that employee is going to need for their home office. That means, are they going to use a laptop? Are you going to let them take the desktop that they had at the office home? Do they need a printer, copier, scanner? What do they need? They do need a shredder. I will tell you that. That's not a question. They need a shredder, because if they do have that paper protected health information that needs to be discarded, they need to make sure that they're shredding that and it's not going in their regular trash. And then basic office supplies, pens, papers, Post-it notes, whatever it is that they have at the office. If they're going to work from home and be productive, they need to have access to those things as well. So you're going to have to go through that list and then determine who's paying for those things. Connectivity. So high-speed internet access. This, so many of us now, as me especially, I'm working from home. There's, kids are trying to log on to virtual school. There is a lot of bandwidth being used. And this is important for your remote workers to understand how their internet access works. Is it fast enough? Are they going to need to make changes to that so that they can support the applications and software that they're going to need to run as they are working remotely? Also, what about telephone service? Do they need, if this is going to be a long-term thing and they're going to be working remotely for your practice indefinitely, do they need a separate telephone line that they can be contacted, as that there is their work number, or are they going to use their cell phone? But how is that going to work? Which brings me right into my next topic, which is ownership, control, and reimbursement. Who is going to supply what? Is the organization going to supply the equipment, or are you going to allow your employees to use their equipment? And if you allow them to use their equipment, how are you going to ensure the security of all electronic protected health information and other confidential information that is being accessed or stored on their personal devices? So these are very important questions. And again, I'm going to touch on that more in the next session, but I do want to bring it to your attention if you're unable to attend that next session. And then you have to figure out who's paying for what. So if your employee has to increase their internet at home in order to have the bandwidth that they need to work, are you going to pay for, is the organization going to pay for that internet access? Are you going to pay for their cell phone, because now they are exclusively using their cell phone as a method to, communicate with your patients or with other coworkers? And then any other expenses that might be related to working from home, back to that I mentioned about office supplies. If they now have a printer that they can use at home, are you going to be supplying the paper and the ink? And all of those things need to be defined, because I think what can go wrong in these situations is when it's unknown. And if you have employees that are spending their own money on things that should really be compensated by the practice, then those are things that you want to do, because that's the fair thing to do. But you don't want to also give free rein to the employee to go spend whatever money they choose necessary to set up their home office. There needs to be parameters in place that you both agree on. So I just want you to think about these things when they are setting up that home office. Now, this is another topic that comes up, is how do we keep remote workers engaged? And so definitely, just like you would in the office, if you're not having regular meetings and you're not talking to people and people are not collaborating in teams, that's probably not going to get any better from a remote standpoint. But if that's stuff that you already have in place right now, or you did prior to sending people remote, continue that. I mean, again, as I mentioned, I work for a 100% virtual company. I am chatting with many of my coworkers on a daily basis. We use Skype, but there are a ton of different applications that can be used from a business standpoint to give quick ability to communicate. Email is probably not, I mean, email is still okay, but it's not quick. And so I would recommend, if you do want to help keep your employees engaged, especially your teams engaged, then look into different ways of communicating. Slack, Google Hangouts, chat, Microsoft Teams, and this is not an endorsement for any of these. These are just a few that I'm familiar with, but there are many. I would recommend that you use something like this in your practice to keep those workers engaged, because you don't want them to feel like they're off on an island all by themselves, and you want to keep that collaboration going. And it's okay to bring people in occasionally. If it is safe to do so, bring people together on a regular basis. Get face to face when you can, of course, with social distancing and masking and all of those things that need to be done to be socially responsible. But there's nothing that says you can't do that. So in addition to that, using video chat. I know people get to the point where they're thinking, I'm working from home. I don't want to shower. I don't want to really get out of my pajamas. And, if they're never having to be on camera, maybe that's okay. But if you think that that is engaging your employees more, then set up a regular meeting that you're going to say, okay, guys, cameras are on. We're going to be looking at each other face to face. You can do those things because you guys are in charge. So think about that as you are trying to work at ways to keep those remote workers engaged. So managing productivity and using tracking software. And this is something that there are plenty of services available. And what tracking software does is it can monitor keystrokes, it can measure the active time that an employee is in an application or on a certain website. It can also monitor and enforce any security policies that you have. So if someone is trying to access a remote site that is risky, and maybe there's a potential for malware, or maybe an employee is trying to download something, when you do have the tracking software in place, or some of the tracking software, that can alert the employee that, hey, you don't need to do that. From a security standpoint, I think there's some really good things that you can do. From a productivity standpoint, what I think you need to determine what your goals are. If you are strictly trying to ensure security, I think that's one thing. If you are really concerned about productivity, and so you feel like you need to see what that employee is doing on a regular basis, then you might need to consider why you've allowed them to work remotely in the first place. But that is something that you have to determine as a manager. If there is a level of trust that maybe you don't have with that employee, maybe the tracking software will help. But I think if there's a trust issue, you really need to look at that relationship and not just try to handle it with tracking software. But I do want you to know that there are some tools out there, but you have to determine how you want to use those within the practice. And so look at those different types, understand how it works, and some other things to consider. If you're going to use tracking software and you have an employee that is using their own personal device, there may be some legal implications that you need to be aware of. So we want to make sure that we are making employees aware that there is tracking software either being put on their personal device, or that is already on existing organizational issued devices. So we want to make employees aware. You should also have written policies in place outlining the expectations of privacy or the lack of privacy. Because if you have the tracking software set up in certain ways, you might have employees, if they're using their personal device, they may also check their banking account. They may check their personal email. They need to be aware of what is private and what is not. And you also need to understand the privacy implications from a legal standpoint. So I highly encourage you, if you're going to deploy any type of tracking software, definitely seek some advice on the topic, whether it's legal advice or whether it's checking with an HR professional. But you want to make sure that you're doing everything correctly, especially within your state, because some state laws are very specific about this. So just keep that in mind if you're going to utilize any type of tracking software. So, to wrap up, just some next steps and considerations for your practice. When you're managing remote workers, number one, you have to determine those roles in your practice, like we talked about, that you can utilize in a remote environment. Not everyone will fit in that mold, but if you have those positions and you can utilize them, then define how they can be utilized. Make sure your remote workers have the tools they need to be productive and secure. We want to make sure that they feel good about the tools that they have and that you feel good about the security in place on those devices. Decide how you want to manage productivity, and this is whether you decide that you want to have certain tasks that have to be completed by certain times, and so that's how you're going to manage productivity, or if you are going to use some type of tracking software to manage that productivity. Whatever works best for you and your employees is what I recommend that you do. And then encourage and incorporate ways to stay connected. If it's been a long time since you've had people get together and talk, develop a standing water cooler call. We do that in our organization, where every Friday at 10 a.m., everyone has the ability to hop on a quick call and talk about nothing work related. Simply just have a little bit of time to connect with each other. And this is so good because these are the things that are happening organically when you are all together, 8 to 10 hours a day, every day in the same spot. Those things don't always happen in a remote environment. So look for ways to encourage and incorporate ways to stay connected. Document the good and the bad to track performance. And what I mean by this is, if it's always, and you guys all know this from an HR perspective, you have to document performance if you're going to take any action. It's always a good idea to document that performance. So if you have somebody that's doing great in a remote position, document that. Be checking on them regularly. If you have someone that's struggling with either getting distracted or not being productive, document that, because when you are at a point where you're going to have to bring them back in the office and they don't want to, you've got to have that documentation just to back you up and to say, this is why you can no longer work from home. And then understand that remote work may not be for everyone. And I think those of you who have been utilizing this within your organization already, you probably know this, because you're going to see really quick who will excel, who will not, who is productive at certain times of the day as opposed to the times of day that you want them to be productive. You're going to see these things as you start using remote workers, or you already are seeing these things. And understand, you can bring an employee back to the office if things are safe and you're allowed to bring in your community. If you're allowed to have employees in the office, then understand that if it's not working for them to be remote, you can bring them back. And then finally, if things are working remotely and it makes sense for your practice, keep it up. Why would you stop? If you've gone through all of this and you've done such a good job of creating these policies and procedures and it's working, just because the COVID-19 public health emergency is over, why would we stop doing something that's working? Especially if you're gaining some of those benefits from having those remote workers. So keep that in mind too, and understand that this may not be something where you have a hard and fast rule that you're bringing everyone back. Now, if in your practice you need to bring everyone back, then do that. But I just want you to understand that if it does work, then maybe you can continue to let it work for your practice. So Again, this is my contact information. If you have any questions that you want to ask after today's presentation, you can reach me by phone or by email. But at this point, I am going to turn it over to you now to see if we have any questions live. So thank you guys so much for participating.